Good afternoon, everybody. So lovely to see so many of you join us for this afternoon's webinar about the heart of the matter. So we're really going to be looking at how cardiac health shapes your overall well-being. So my name is Anna Jones. I'm the chief nurse here at Blue Crest, and I've been nursing for 29 years now. I'm also a community nurse specialist. And what's important to me, well, it's about empowering people and supporting people to be able to live as healthy and as long as life as possible, and making sure everything we deliver is of high quality care. So over to you, Ian.
Thank you. Hello, everyone. My name is Ian Neale, and I've spent over 30 years exploring how nutrition, movement, and mental well-being all fit together. My journey started in the kitchen. I was a chef at Fortnum and Mason's, and that experience sparked a real curiosity about how the food we eat affects your health. From there, things evolved. I trained as a sports and movement teacher. I've coached with British Cycling and also Archery GB, and later I became an executive and business coach with the ICF. Today, I'm part of the health coaching team here at Blue Crest, and what really drives me is helping people see the link between mindset and the body to create lasting well-being. When those two things work together, amazing things can happen. So my goal today is very simple, is to share my insights that you can use on your own health and well-being journey. So I think over to Anna now to talk about Blue Crest.
Yeah, just tell you a little bit about who we are. So we were founded back in 2012 with that aim to bring affordable health assessments to the market. And at that time, it was very underserved. And what was very important to us is with everything we do, we have quality at its heart. So today, we're a health intelligence company. We want to give all of our customers that vital insight into their health and give them the confidence to be able to go and manage their health as well as they can. And our mission is very similar to my personal one, that we want to help customers help you live healthier for longer by making health monitoring easy and affordable. And we do this on scale. So to date, we've done about 1 million health assessments. We run 14,000 clinics a year across the UK and Ireland. And as you can see, we've got a great customer satisfaction rating. And for us, it's simple. Prevention is the key. That is what is so important to us. Over to you, Ian.
Okay, thank you. So I'm just going to literally run through a little bit about what we're going to be saying, what we're going to be doing today. So basically, your heart is the engine of your body. It's pumping blood and oxygen to every organ. And when it's healthy, everything works better. Our energy, our brain function, even our moods. But when our heart health declines, it impacts on your entire system. So two major risk factors of this are high cholesterol and high blood pressure. Elevated cholesterol can clog the arteries, and while a high blood pressure strains the heart and also vessels. Together, they significantly increase the risk of heart disease and stroke. And the good news, you can manage cardiac health through simple lifestyle choices. So eat a balanced diet, rich in fruits, vegetables, and lean proteins. Stay active with at least 100 minutes of exercise weekly. So that can be just walking, avoid smoking, and manage your alcohol intake and stress. And finally, prevention and early detection are key. Regular health checks for blood pressure, cholesterol, and heart rhythm can catch problems before they can become serious. So small steps today protect your heart and your future. There will be an opportunity for questions at the end, so could you please leave any comments that you have in the chat, and we'll move on to the next one. So basically, heart health is central to our overall well-being because the heart is responsible for pumping blood, as I said, oxygen-rich blood to every part of the body. And when the heart functions well, it supports brain health, muscle strength, and organ performance. So poor heart health, however, can lead to high blood pressure, diabetes, complications, and even cognitive decline. A healthy heart reduces the risk of stroke, kidney disease, and certain types of dementia. And lifestyle factors, as I said, like regular exercise, balanced nutrition, and stress management not only protect the heart, but improve your energy levels, your mood, and longevity. So in short, caring for your heart isn't about avoiding heart disease. It's about maintaining a strong foundation for your entire body and mind. And just a fact for you that heart disease remains the leading cause of death worldwide. And surprisingly, over 80% of cases are preventable through lifestyle changes. And some quick tips, as I said, 150 minutes of moderate activity per week. That's brisk walking. Eat smart, so prioritize fruits, vegetables, whole grains, lean proteins, and reduce salts and ultra processed food. You can look into things like the DASH diet, which is the dietary approaches to stop hypertension, which is high blood pressure, and that lowers the risk of cardiovascular disease by 20%, and that's from the British Heart Foundation. Manage your stress, so practice mindfulness or breathing exercises during your workday, because chronic high levels of cortisol, often caused by long-term stress, can lead to side effects like weight gain, increased blood pressure, and also muscle pain. Stay hydrated. Water supports circulation and overall health. And also know your numbers. Keep an eye on your blood pressure, your cholesterol numbers, and also your blood sugar levels. It's not about living longer, it's about living better. So I just want to do a little bit about what cholesterol is, because not everyone is aware. So cholesterol is a naturally occurring substance in the body. It's essential for the production of healthy cell membranes, hormones, bile acids, but it also aids brain health. However, because of our modern diet and our lifestyle, levels are elevated, and elevated levels are harmful as they increase the risk of cardiovascular diseases like angina, heart attack, stroke, and peripheral vascular disease. Cholesterol is produced naturally in the liver. We consume it through the foods we eat. And there are two main types. There's HDL, the good cholesterol, or the happy one. That's the way I remember it. It's H for happy. And this takes cholesterol from the bloodstream back to the liver to be reprocessed and disposed of. And good levels of HDL are an indicator of a healthy cardiovascular system. The other type is non-HDL. This takes the cholesterol from the liver. So HDL is high density lipoprotein. So the non-HDL takes the cholesterol from the liver back out into the body, and it's referred to as the bad cholesterol because it can build up in the arteries. High levels of this can indicate a surplus of lipids in the blood, which can increase the risk of cardiovascular complications. So another one is triglycerides, which are a type of fat that is produced straight after eating and drinking. So when you drink alcohol, it's broken down and rebuilt into triglycerides and cholesterol in the liver. So again, lifestyle factors increase your risk of cholesterol would be consumption of alcohol. That's over a maximum of 14 units a week, or about 6 pints of 4% beer, or 6 glasses of 13% wine, 175 ml pub measure. Saturated fats, if you do eat saturated fats, try and choose leaner cuts of meat. Smoking, low activity, and also high levels of body fat. So just to talk a little bit about the impact of cholesterol on health. So it isn't just a number on your test, it plays a major role in heart health. When levels are too high, it can significantly damage your arteries and can lead to life-threatening events like heart attacks and strokes. A heart attack happens when blood flow into the heart is blocked, normally by a clot. High cholesterol contributes to this by damaging artery walls and forming plaque. And plaques can rupture and trigger a clot that can block the blood flow. So if you have a heart attack, some of the symptoms would be chest pain, pain radiating to arms or the jaw, shortness of breath, or sweating. So if you suspect a heart attack, do not hesitate. Call the emergency services immediately. So when the artery lining cells are damaged, that can be done via smoking, high blood pressure, hypertension, or high cholesterol. The fat and immune cells accumulate, forming plaque, and over time, the arteries harden and narrow, reducing blood flow. In the heart, this causes angina, and if the plaque bursts, it can lead to heart attack or stroke. And strokes occur when the blood supply to the brain is disrupted. And there are three main types: ischemic stroke, and these cause about 85% of strokes, and that's damage by a clot. Hemorrhagic stroke, which is the vessels rupture, bleeding into the brain, and this is often due to high blood pressure or an aneurysm. And the other one is the transient ischemic attack, which is a mini stroke, which is a temporary blockage, which is a warning sign for future strokes. So it's definitely worth getting it checked out. The last one on our list is peripheral artery disease. So PAD is a narrowing of the arteries in the legs due to atherosclerosis, the same process driven by high cholesterol. Symptoms are leg pain when walking or cold feet, and the causes are smoking, high blood pressure, high cholesterol, and diabetes. And the consequences of PAD is an increased risk of heart attack, stroke, and limb loss. So it all sounds a little bit doom and gloomy, but the good news is that lifestyle changes, i.e. quitting smoking, lowering your intake of alcohol, plenty of exercise, and also medications, possible surgery for severe cases. So basically, managing cholesterol isn't about avoiding heart disease. It's about protecting your brain, your limbs, and your life. Small changes, healthy eating, exercise, quitting smoking, and cutting down on alcohol make a big difference. And I'm going to pass you on to Anna now, who's going to talk to you about blood pressure.
Yeah. So blood pressure is such a good indicator of health status, and I would say it's probably one of the most important parts of a general health assessment. So what it does is it measures the force of blood that's going through the walls of our arteries as the heart pumps through our body, and we measure it with two numbers. So the systolic pressure is your top number, and that is during a heartbeat when the muscle contracts and pumps, and the lower number we call the diastolic pressure, and that is as the heart muscle relaxes. And we say a normal blood pressure is around 120 over 80. And if we've got a normal blood pressure, it's keeping our heart and our arteries healthy and ensuring efficient blood flow to our organs. And because of this, it's going to reduce the risk of heart disease, stroke, and potential kidney problems. So incredibly important. So if we look at the next slide, when we talk about high blood pressure, we call that hypertension. And it's really dangerous, and it's known as the silent killer, and for really good reason. Because what happens is that it's developing often without noticeable symptoms. And during this time, our body is being silently damaged and putting us at risk of sometimes some really life-threatening and harmful complications. So many people are completely unaware they're living with some of those risk factors, which are most commonly associated with heart attack and stroke. So important. And if we look at the scale of this issue, in 2019, the British Heart Foundation did a study, and they estimate there's 4 million people in the UK under 65 with high blood pressure, and therefore living with those risk factors for cardiovascular disease. So I'll just tell you a little bit more about what high blood pressure can do. If we're looking at it in terms of our heart, it increases the workload. So that means our heart has to pump harder, and in time, this leads to thickening. We call it hypertrophy of the heart muscle, especially in the left ventricle. And over time, what happens is this thickened heart muscle becomes so stiff, it reduces its ability to fill and pump effectively. And in time, our heart will weaken and fail to meet the body's demands and needs. And we call that somebody is going into heart failure. We also worry about high blood pressure in terms of artery damage. A bit like what Ian said, it damages the artery walls, leading to plaque buildup, which we call atherosclerosis. And those arteries become narrow and they become stiff. And what happens in time is that fatty plaque can break and rupture, and is either going to form a clot that can flow in our bloodstream and cause an ischemic stroke, where we haven't got enough blood flow going to our brains, or the blood vessel can rupture and we will have a severe bleed, what we call a hemorrhage in and around our brain tissue. And both of these are really dangerous when we don't have that vital oxygen and nutrients going to our brain and tissues. That's when we start to see cell death and often irreversible damage. So again, really important about keeping our blood pressure within normal limits. And we talk about the heart, but there's also big issues that high blood pressure can cause to our kidneys. And we call it, well, we call hypertension one of the leading causes of chronic kidney disease and kidney failure worldwide. And our kidneys are vital to us. They filter our waste, they balance our fluids, they regulate our blood pressure. So when hypertension damages them, this harmful cycle then begins where each condition then worsens each other. And it's the high blood pressure, what it does is it puts that strain and damage onto the walls of blood vessels throughout the body, including those that supply the kidneys. And as those vessels become narrow, thickened, or hardened, we get that reduced blood flow to the kidneys. And of course, when less blood flow reaches the kidneys, they receive less oxygen and nutrients. And as a result, they're going to work less effectively and they aren't going to be able to remove that waste or manage the fluid. And we will see that building up in the body. And of course, then as the kidney lose function, it then doesn't regulate our blood pressure effectively. And we can then come into issues such as retaining more salt and water. Again, a dangerous feedback loop to be in. So high blood pressure also damages our eyes. So the most direct condition caused by high blood pressure is called retinopathy. And that occurs when we've got elevated pressure, which damages this pressure around the small blood vessels, around the retina. And in early stages, this can be blurred vision that can ultimately lead to vision loss. And then there's also another condition affecting our eyes called optic neuropathy. And that's where we've got restricted blood flow to the optic nerve, which again causes damage or death of nerve fibers, and again will lead to vision loss in one eye or both eyes. So really significant. We're also seeing the impact of high blood pressure on some of our neurodegenerative conditions, so things such as vascular dementia, again being caused by that reduced blood flow to our brain tissue. And blood pressure high blood pressure can even cause mild cognitive impairment and issues around that. As Ian talked about, blood pressure can also put us at risk of peripheral arterial disease, where we're going to get that narrowed arteries and we're going to get that pain and cramping in our legs. But things we don't talk about quite as often related to high blood pressure would be things such as sexual dysfunction. So in men, it could cause erectile dysfunction. And in women, high blood pressure can lead to loss of libido and reduced sexual satisfaction. It can also impact our sleep. So poor quality sleep can be caused whereby we have obstructive sleep apneas, again, due to the high blood pressure. So it's really significant, just the amount of issues it can cause us. If we could go to the next slide. But the good news is that we can do something about this. And one message to please take home from today is that taking care of your heart is one of the best investments you can make into your long-term health and well-being. And it doesn't always have to be big changes. It can be those small, consistent changes in your lifestyle that will gradually greatly reduce your risk of heart disease, high blood pressure and stroke. But alongside this, hopefully boost your energy, your mood, and your quality of life. So some of those things we really recommend would be reducing and stopping smoking. And actually you'll see the benefit of this so quickly within 20 minutes of after having a cigarette. But after 1 year, your risk of heart disease, if you quit smoking, cuts in half compared to a smoker. And in 15 years of quitting smoking, your risk will be similar to someone who has never smoked. I'm sure you hear lots of people talk about being more physically active, but again, we can't estimate and emphasize this enough how important it is. So we recommend the 150 minutes of moderate exercise, but also making room for some of the strength and muscle strengthening exercises. And remember, if you're just starting out with this, those 10 minutes of exercise will add up throughout the week and count to your goal. And if you're really not into doing some of this big exercise regimes, just think of those little changes you can make. Take the stairs instead of the lift. Go out for lunch, have a walk in your lunch break, have walk and talk meetings. It's all about finding things that will work for you. And of course, nutrition plays a huge role in our cardiovascular health, and a balanced diet really helps us manage our blood pressure, cholesterol, and our body weight. So think about what we eat, the healthy diet, the fruit, the vegetables, those 5 portions a day, swapping whole grains instead of refined ones, really limiting our processed foods that we know is driving inflammation, reducing those sugars, really looking at the fat intake and swapping out fats for those healthy fats, really looking at getting in your right intake of omega-3, all of those foods that are going to help reduce inflammation. And also really think about managing stress. We all work in, life can be very stressful at times, but find something that you can help manage your stress, because stress will elevate our blood pressure. It increases our inflammation, and at the same time also contributes to unhealthy habits. So we know when we're stressed, some of those good behaviors will go out the window. If we drink alcohol, we may well be having more. We may well smoke more. We may well give up exercise because we can't fit it into that week. But actually, these are all the habits that we need to avoid. So really, really think about that. And alcohol. Alcohol is showing as one of a big driver and risk factor for cardiovascular disease. So limit your alcohol, keep within the guidance of 14 units a week, and definitely try to have some alcohol free days a week will all help you. So just going to show you the power of preventative health. And again, really need to emphasize this, that it's getting those early insights. Many of us don't know we live with some of these risk factors. Many can be silent. So by having those health checks, we're hopefully going to pick things up at the earliest opportunity. And I won't read this, but the story of Mr. Howe went into his health check, never expecting to be served this result. And what it showed is we found out that he had a serious blockage in his heart, whereby he needed to get the help of a cardiologist, and went on and needed to have surgery. And actually, if he hadn't had that health assessment, the cardiologist's words were, "You were really cutting it fine." And we see every day, I sit within the results function here at Bluecrest, just the high level of critical blood pressures that we're picking up and high cholesterol levels. So yeah, we can't emphasize its importance in making sure you have those regular health checks, really making sure you're looking at blood pressure, cholesterol, and particularly your weight. So I'll hand back to you, Ian.
Okay. So as one of the health coaches here, the cholesterol slide that when the slides that we use when we're coaching, the cholesterol slide is one of my most used slides. And actually, it's unusual to talk to somebody that does not need to talk about some form of cholesterol. And as I said, it's one of those things that comes up an awful lot. One of the most useful elements of the Bluecrest Health Report is the traffic light system that we use, because it provides quick and easy to understand visual feedback, and that gives us something to talk about. And it's and as in the case of this gentleman now is the case of Peter, who said he had red and amber flags around his heart health, and he also spotted atrial fibrillation. So atrial fibrillation, or AFib, is the most common type of irregular heart rhythm. So instead of beating in a steady pattern, the upper chambers of the heart, called the atria, they quiver or they beat chaotically. And this can cause the blood to pool. It can increase the risk of clots, stroke, and heart failure. So symptoms may include palpitations, fatigue, or shortness of breath. But some people have no symptoms at all. So AFib is treatable through lifestyle changes, medication, and sometimes procedures. So early detection is key. So this gentleman went to his GP, which led him to have both his mitral valve and his aortic valve replaced. He had a cardiac ablation, which is where they go in with either cold or heat, so either a laser or freezing, and it stops the multitude of signals being sent around the heart. He also had a heart bypass and a pacemaker fitted. But because of the results of his health assessment, he believes that this saved his life. So I'll pass back to Anna again.
Thank you, Ian. So this slide shows you some of our packages, and again, we've got a wide audience on the call, so check with your account manager what's included. But most of our health assessments go in and measure some of those key tests that give you such vital insight about your cardiovascular health. So your blood pressure, your cholesterol, your heart disease and stroke risk score. We're really proud at Bluecrest of some of the other testing we do. So around PAD, a lot of our assessments have ECG, and we've got a lot of cutting edge tests out there. And I can see a lot of the comments coming up in the chat. I've just had a good look, may well want to look at some of this additional testing. So things like lipoprotein A is a great test at showing us your genetic risk factor to cardiovascular disease. We've got tests such as plaque, which will give you a good indication of damage already in your vessels. And recently we've just brought out ApoA and B, which is a great advanced cholesterol test looking at the transport of cholesterol around your body. So please find out what's included in your health assessment and look at some of those products. But certainly my recommendation to you is keep regularly checking your blood pressure, your cholesterol and your body weight. They give you such vital insights. Don't underestimate that. I'll just tell you a little bit about the next slide and our really exciting new partnership with One Heart Clinic. We went into partnership with them last month. They're a specialist cardiology centre and they're available to our customers. And what this means is that we've got a direct route now for our customers that we're identifying some of those risk factors in. And it means our customers can take those results and go and pursue further diagnostic ECG testing, echoes, or meeting a cardiologist. So really excited to be able to tell you about that. So that concludes our webinar. It's been a whistle-stop tour and we would love to come on and maybe go into some of these subjects more in depth. So please give us some feedback as to what you're looking for and we can try to accommodate. But certainly looking after your heart health, making those what might seem like small changes can make such a big difference. So don't underestimate that, and please don't leave things too late. We need to move into the preventative health space. So thank you so much for joining. You will receive the recording by email if you want to revisit any of this and absorb some of the information. I know we've told you a lot. We'll also be sending you a recording as well. So sorry, we'll be sending you a survey along with the recording. So I think we may well have to answer some of your questions individually. We can look at these afterwards, but certainly a few questions around cholesterol and statins. So there is a lot of research on statins. I think it is a personal choice. So I would really recommend going and having that conversation with your own healthcare professional that has got your records. There is a lot of things you can do to bring down cholesterol, your diet, your exercise, some of the things we've talked about, but some people will need the help of statins. So you need to go and have that conversation with your healthcare professional of where does the risk sit, and actually weighing that with what might be a risk of a statin alongside what are the risks of walking around with a very high cholesterol that's not lowering. So I would advise you to go and have a look. A couple comments about low blood pressure. So I think there was one about 100/70.
Yep.
So actually that's okay. Some of us do run a lower blood pressure. We would advise you to go and get help when you start maybe getting symptoms. So maybe feeling a bit dizzy when you go from sitting to standing,
Yeah.
or waking up in the morning. But generally blood pressure a bit on the lower side of normal is okay. I can see someone's querying a blood pressure of 140 over 90 that was picked up in their health assessment. So yeah, that is a little too high. So you should be getting your advice in your results report, which you may well not have landed with you yet, but we will be asking you to, well, advising you to go and get that checked. Sometimes it can be white coat syndrome, and so we need to make sure that it's not that. And if it is that, then have that discussion about how you can bring that blood pressure down. We don't want to see that blood pressure of 140 over 90 if we can help. So I'm seeing some, again, apologies, I can't answer them all directly now, but people talking about risk factors. Certainly if you have got some history of cardiovascular disease in your family, that puts you at increased risk. So again, definitely at very least engage in some of the generic screening that we do, such as your blood pressure, your cholesterol, but you may well, with a history of cardiovascular disease and premature death of parents in your family, want to think about some of that advanced testing so that you can get a bit more of an insight and make some more informed choices. Ian, any you can pick up?
I've just noticed one about low heart rate of being 40 beats per minute. That's marked bradycardia. It will really depend again on your lifestyle. If you're an athlete, if you are training to run marathons and various things, and you're eating well, then it's bradycardia, it's marked bradycardia, but it's not an issue as much as of an issue if you said to me that you were a please excuse this, but couch potato, you're eating the wrong foods, you're eating processed food, you're eating high fatty foods, you're getting all your calorie intake from ultra processed food, so very calorie dense but not particularly nutrient dense. A lot of people who are athletes, I said I was a British cycling coach. I've trained young people who've had heart rates of 40. It's always worthwhile getting it checked out just to make sure that it's not being caused by something else rather than your fitness. Okay, so again, always speak to a medical professional about this if you are concerned. Apart from that, I can't see anything new or different than you've already. Obviously, there are individual questions, but we obviously can't answer all of those. Our apologies.
Yeah, I will work through some of these afterwards, but I'm also just thank you so much for such lovely comments, everybody. But I'm picking up quite a few people there that are showing their own personal stories where Blue Cross has identified high blood pressure, deteriorating other health conditions, long-standing heart issues have been picked up through the health check, which has prompted further tests, and can't thank the service enough. So, and again, I think another example of a friend there who went on and needed a triple heart bypass. So I think they all confirm that we go into many of these health checks. We don't always know what's going on the inside of our bodies. We take a lot of notice, I think, how we look on the outside, and actually we need that lens of that health check to give you that insight of what may be going wrong inside us before those symptoms come. And I think those case studies just show the power of preventative health.
And also the power that you guys have, because a lot of the people I coach with had their check maybe a month or 2 months ago, and they're already making major changes in their lifestyle because it's almost like holding the mirror up. And as Anna said, a lot of these things we're not aware of. We can quite happily live with them. So to have them brought to our attention, then we can deal with them, either yourself or your medical professionals. So yes.
Yeah. One last question I can probably quickly just answer. Jill, you've queried around food products. Definitely there is some science in some of those, but nutrition in general, if you've got some risk factors, really advise you go on and Blue Cross has got some blogs about some of this nutrition. We're doing a lot in the space now as well around inflammatory foods, so foods to avoid that fuel inflammation, but also those foods that can give us such an anti-inflammatory and protective effect. So certainly if you're sitting there, well, we should all be looking at good nutrition, but if you're sitting there with some of those risk factors for high blood pressure and cholesterol, really do urge you to do some work on nutrition and really look into that. So just mindful of time. I think we'll probably have to come to an end, but I think there's a few more personal questions that I will try to get answered for you. So hopefully you found it informative, and you'll attend some more of these in the future. So thank you.
Thank you all for your time. Take care and goodbye. And good luck on your health journeys, all of you. Not that scary.